A recent case of an epileptic patient lying helpless on the road with no one willing to help. Epilepsy is a disorder in which nerve cell activity in the brain is disturbed, causing seizures. Epilepsy may occur as a result of a genetic disorder or an acquired brain injury, such as a trauma or stroke. Speaking with a medical practitioner, Dr. Aina Omodele stated that epilepsy is as a result of seizure in the brain, and patients suffering from such should not be ignored, but should be assisted as quick as possible by removing their ties if they are putting any on, also helping them by placing them where they would not get injured by placing an headdress before placing their head. Dr. Omodele also said epilepsy cannot be cured, but it can be treated. Reasons being that before one can be diagnosed of epilepsy, the person must have had seizures 2 times, and after the person has been given medications and the patient constantly takes his or her medications, the seizure would not be frequent.
It's a common neurologic problem, and as a matter of fact, epilepsy is common in the community. So we know that 1 in 26 persons worldwide would have epilepsy in their lifetime. 1 out of 26 persons. Okay, and the epilepsy is a disease of the brain that makes the sufferer to have recurrent seizures.
Dr. Omodele said research has shown that in a group of 26 persons, 1 person would definitely have seizure of the brain.
Epilepsy is just there. The neurons in the brain just fire occasionally, and then the person manifests as having seizures. So now, if we see a person have a seizure on the street, so what do we do? So the first thing is that we should all stay calm. There's no need to start running and then you are running away from the person like something catastrophic has happened. You see a person have a seizure in your presence, stay calm. That is 1. Number 2, you should remove the person from any potential harm. Okay, so let the person be away from harm, because the seizure the person just seizes. It wasn't the person didn't know when it would happen. It just seizes. So it just happened sporadically like that. So you have to take the person away from any potential harm. Okay, and then if the person is wearing things like a tight clothing, for example, if the person wearing tie, okay, because of the seizure activity, might strangulate the person. So remove all those tight clothing and all that. Okay, then you should try to cushion the head. Okay, because of the continuous seizure activity, the person could hit his head. So if you could place probably a piece of clothing just under the head of the person.
So when next you see an epilepsy patient, do well to assist. Praise Irabo, reporting for BTV News.